Hypovolemia occurs when there is not enough fluid volume or blood in the body as a result of injury or an underlying condition. This means that the body is not able to maintain adequate blood pressure and circulate the blood properly. This makes the heart have to work harder to pump blood, which is why tachycardia is being noted. 3 challenging next generation NCLEX questions you need to be able to answer. Are you feeling nervous about the latest next generation NCLEX? Here are 3 tricky practice questions and answers that will help you build up your confidence before your next test. The first is the classic. Select all that apply. That is part of the next generation NCLEX. Question 1. Nurse Lynn is providing care for a 68-year-old patient who was admitted with deep vein thrombosis, DVT. The nurse noted that the patient has a history of chronic atrial fibrillation and has been prescribed warfarin therapy for the past year. The provider has added enoxaparin to the medication list in addition to warfarin until the INR is at a therapeutic level. Which of the following actions should the nurse take to provide appropriate care for the patient? Select all that apply. A. Assess for signs and symptoms of swelling, warmth, and redness in the legs daily. B. Instruct patient to report signs and symptoms of headache or dizziness. C. Monitor the INR and platelet counts as ordered by the provider. D. Encourage the use of a soft bristled toothbrush. E. Encourage the use of an electric razor. F. Administer enoxaparin in the arm to avoid interference with warfarin absorption. And the correct answer is A, B, C, D, and E. Assess for signs and symptoms of swelling, warmth, and redness in the legs daily. Instruct patients to report signs and symptoms of headache or dizziness. Monitor the INR and platelet count as ordered by the provider. Encourage the use of a soft bristled toothbrush. Encourage the use of an electric razor. Rationale. The nurse must monitor for signs and symptoms of deep vein thrombosis and the effectiveness of anticoagulation therapy, so it is crucial to assess for swelling, warmth, and redness. Headaches and dizziness can indicate bleeding complication, which is hard for the nurse to assess for, so education is essential. So the patient will report to the healthcare staff if he or she has a headache or starts to feel dizzy. INR monitoring is done for patients on warfarin therapy to ensure the appropriate levels are being maintained to reduce clotting or bleeding risk. INR levels that are too low puts the patient at risk for blood clots. INR levels that are too high puts the patient at risk for bleeding. Platelet monitoring is done to detect signs of heparin-induced thrombocytopenia, HIT, when a patient is on enoxaparin. The use of a soft bristled toothbrush and electric razor are actions to minimize bleeding risk. Warfarin is taken orally, so where enoxaparin injections are done does not affect warfarin absorption. Now here's the rationale for the incorrect answer. Enoxaparin injections should not be administered in the arm, but in the abdomen for proper absorption. Get ready for your next question. I am going to throw a chart and a drop-down menu at you. Let's see what you got. Question 2. The CNA is monitoring the vital signs every 15 minutes and reporting the findings to the nurse. Complete the following statement by choosing from the list of options. The patient is most likely experiencing, select from list 1, as evidenced by, select from list 2, and select from list 3. And the correct answer is, the patient is most likely experiencing hypovolemia as evidenced by hypotension and tachycardia. Rationale. From list 1, you must have an understanding of what hypovolemia, atrial fibrillation, and hypervolemia are. Once you get an understanding of each topic, you can take a look at the vital signs from the chart and determine what the patient is most likely experiencing. Hypovolemia occurs when there is not enough fluid volume or blood in the body as a result of injury or an underlying condition. This means that the body is not able to maintain adequate blood pressure and circulate the blood properly. This makes the heart have to work harder to pump blood, which is why tachycardia is being noted. Since blood pressure is not stable during hypovolemia, hypotension would also be noted. Hypervolemia is the opposite of hypovolemia, in which there is fluid overload in the body, which can be a result of the body's retention of water and sodium. Hypertension would be noted, not hypotension. The increase in temperature from 9 to 9:30 is so minor and is not related to any of the choices from list 1. Atrial fibrillation is an irregular and rapid heart rhythm. The vital signs stated that the patient is experiencing tachycardia, but the heart rates are normal. Atrial fibrillation should be eliminated. Okay, how are you holding up? Did you get the last 2 questions correctly? If not, that's what I'm here for and what the replay button is for. Every like, comment, and subscribe goes a long way and helps me create more videos where we break down the hardest Next Generation NCLEX question. I appreciate all of your comments, so please like this video, subscribe if you haven't already, and share this video with your fellow aspiring nurses. Let's jump back in with renewed energy. One last Next Generation NCLEX question to go. You got this. Question 3. The nurse is reviewing the electrocardiogram, EKG, of a patient who was admitted to the unit with palpitation and shortness of breath. Which is the correct interpretation of the patient's cardiac rhythm? A. Atrial flutter. B. Atrial fibrillation. C. Normal sinus rhythm. Or D. Ventricular tachycardia. And the correct answer is A. Atrial flutter. And here's the rationale. Atrial flutter has a sawtooth pattern, also known as flutter wave. When a patient is experiencing palpitation and shortness of breath, atrial flutter would be an expected finding. Keep in the back of your mind that administering oxygen can alleviate signs and symptoms of hypoxia. There are a lot of squiggly lines in between the big spikes with atrial fibrillation. Atrial fibrillation is actually a common atrial arrhythmia. Sometimes patients don't even notice it. However, it is still a problem because the blood is not fully pushing out of the atria, since the atria is not fully contracting. The patient is at risk for blood clots since it can start to clump together. This EKG indicates that the patient is experiencing a normal sinus rhythm, which is a regular heart rhythm in a healthy adult. The normal heart rate is 60 to 100 beats per minute. If the nurse is seeing this cardiac rhythm on the EKG strip, then the nurse must prepare to treat the situation as an emergency. Assess the patient immediately to determine if there is a pulse or not. The patient would not have a pulse. And this EKG that we're talking about is ventricular tachycardia, or VTAC. You just completed 3 tricky Next Generation NCLEX question and answers. I am so proud of you. If you managed to get all 3 questions correct, you're well on your way. If you got more than 1 incorrect, hit that replay button and get yourself comfortable with my rationale. That's what I'm here for. Looking for more tips and tricks to make your journey even more fun and engaging? Check out my next video where we dive into more essential nursing school hacks. Thanks for dropping in and see you in the next video.